Good morning. Good morning. I'm very pleased to join you all this morning. Let me just get myself organised. So, it's always terrible when you see a big photograph of yourself up in front of people. I am very pleased to join you all this morning. My name is Lourda and I currently work as one of the Deputy Chief Medical Officers in the Department of Health. Now, as you can hear, I'm not from these parts, but I am very pleased to say that this month, marks 20 years since I moved to Northern Ireland and since I started working in the health and social care system in Northern Ireland. And the first place I moved to and the first place I worked in Northern Ireland was Derry. And when I moved here 20 years ago, I knew one person in the city. I didn't know anybody I was going to work with, and I had been in Derry twice before I moved here. I'm really pleased to say I spent 2 fantastic years working with what was the old Western Health and Social Services Board and the constituent trusts that we had at the time in the healthcare system. I had moved from Dublin. Derry afforded me the ability to buy a house. I would never have been able to buy a house in Dublin in the middle of the Celtic Tiger. But more importantly, Derry gave me some superb friendships and supports and a huge amount of learning in the first years that I spent in the health and social care system here in Northern Ireland. So I'm not a specialist in addiction or recovery or mental health, but what I am is a public health physician. And I work as a public health physician and at the moment in government. And our primary role in government obviously is to, as part of the whole team in the Department of Health, advise the Minister who in turn participates and brings everything to the executive. So I'm coming at this really today, and when Gary asked me to speak, he said 2 things. One, it doesn't matter, you're not an expert in the area, and I thought that's good, I'll stay and I'll hear from everybody else and learn a lot during the day. Second thing he asked me to do was not talk too much about medical or health service flowery things with acronyms, but to talk a little bit about myself and what I bring to this journey as we all think about how we recover together. So that's hopefully what I'll do in the next couple of minutes. Very briefly, just to say to you, these are the places in the 20 years in Northern Ireland that I've worked in. The old Health and Social Services boards before we reshaped under the Review of Public Administration. Prior to this role, I worked in RQIA, which is the systems regulator. And before that, I spent a lot of years in the Public Health Agency from when it was established in 2009. In the middle of all of this, there have been some really challenging times, as you can imagine, but there have been some absolutely fantastic times as well, where the power of people working together really stood to me and stood to what was delivered. And of course, as you will recall, as Gary mentioned, the pandemic was one of the prime examples of that. What I do is systems-based medicine. It's not individual treatments of people. I left that about 20 years ago. But what I do is work at a system level. And as you can see, I include this picture all the time to remind myself that I do nothing on my own. Everything I do with teams and people and other people. And that's really important for me to remember in the context of today's theme, which is recovering together, because we all bring something hugely important to the journey of recovering together. That's just an explanation of what public health from a public health physician perspective is. It is a science and an art. It's not just science. It is about the relational and artistic aspects of our lives and what it brings to our lives. It's about promoting and protecting health and well-being, the prevention agenda, and it is about prolonging life through all of our collective efforts, which hopefully chime very well with what our key theme is today. Now, systems medicine is not a straightforward thing, as I know all of you will really appreciate. It's complicated, it's complex. For everything we do, there are probably a whole host of other unintended consequences and other actions and reactions. Very complex organisations. We're a small and very complexly formed place, but we're tight-knit and we have the benefit of huge value to personal relational working, which I think is really a real strength in Northern Ireland. A lot of what I do is about balance. It's about looking at balance trying to think about balance, trying to do right by the group and the population, and trying to balance individual medicine with group medicine. But the rest of me, along with this, is obviously a wife, daughter, sister, and friend. The wife piece being the piece that brought me to here in the first instance. And I have really had the benefit of very strong supporters along the way as I have lived and worked in Northern Ireland. And I've had people who, for I don't know what reason, have said, oh, I think you can do this. Can you come and do this? Can you work with me? I see what you might be able to contribute. And that has really struck with me, because I know as we all walk through this journey of recovery together, it is really important that we take a time to see the benefit and the value that we all bring. It's not, for me, about a very top-down approach saying this is what you need and this is how it will be delivered. It's very important as we reform our healthcare services and systems that we think about what the uniqueness of each person's journey is and what each person needs in terms of value and appreciation. I've had fierce friendships, and they've been really important, and they've been important in the good times and the bad times. They've been really important in the COVID pandemic and some of the really, really difficult times. And I've also had significant opportunity. I've had people who have taken that step or pushed me forward into a step that I mightn't have taken myself. And recently, I've had the opportunity to spend some time with people in healthcare systems in other parts of the UK and beyond, and really learn to see what they are doing and thinking about in terms of meaningful reform. More recently, we've also had a lot of family celebration, the arrival of a first great-grandchild for my mother, who is 89, who continues to be a powerhouse. And I see the value in strong family support and family leadership. I am also, though, on the other side of this, as we all are when we bring ourselves to work, somebody who has suffered really significant loss and bereavement. I lost my father on Christmas Eve as an 11-year-old. He had a cardiac arrest in our house and was unsuccessfully resuscitated. I lost my brother in 2018, 2 years before the pandemic, from a combination of lung cancer, cardiovascular disease, alcohol abuse, and probably not the strongest life choices. And in that context, I have suffered significant family disconnection and fragmentation of relationship. And I have also, in the early years of my career, suffered serious surgical illness, necessitating long periods in hospital, a huge amount of surgery, periods in intensive care, and the experience of really feeling that you go from being well one day to being very unwell in a number of hours. So all of these things shape me and shape what I bring to our recovery journey. As all of you coming today and all of the work that you do, all of the support you provide, all of the engagements with your families and communities you bring yourself to. And that's one of the things that I'm particularly keen as I work with our junior doctors as they come through our healthcare system, that we don't have an expectation that they turn up as something different at 9 o'clock in the morning. They turn up as themselves in the context of the complexity of their lives and what they bring and the challenges of their lives and of our healthcare system. We are shaped by our experience. Our experiences, I am obviously, as you can imagine, in these years very shaped by the experiences of the COVID pandemic. I moved at very short notice in 2020, 2 days notice, to the Department of Health to contribute to what we thought would be a 3-month response. Turned out to be 2 years, some of the most challenging contexts we have ever been in, but some of the most rewarding work I have ever experienced. And huge learning for me in terms of the value of what we can deliver together if we all point in the same direction and we all recognise and value what we can do together and how we can do things differently. While it was a really challenging experience, the hope for me within the delivery of the experience is really, really loud. I have, as I mentioned, had periods many years ago of serious surgical illness. And the reason I reflect on that is to share with you that I think we need more people in our healthcare system who have experience of illness, of be that physical illness, mental health, substance abuse challenges, because it's only by really including people as full partners in design and delivery of our healthcare systems that we're really going to reform and make a true difference to people. And as I have mentioned, I also, of course, am shaped by my own family experiences, and I include this slide just to highlight to you that under the leadership of the Chief Medical Officer, the department has recently launched a new website, which is called Bereaved NI. It's part of the work of the Northern Ireland Bereavement Network, and hopefully that is a compendium of all of the available resources for people. And we're quite proud of that work in a context where we are very financially challenged. It is really important that we do our best with the resources we have, and this website is exactly that. It cost us very little to do, and we're hoping that it will be of benefit to people who need help and support. So very briefly, just if we think about, I'm just going to think very briefly, and this is the only, I hope these slides haven't come out too well. I'm not going to focus too much today on data and the information. There will be many more specialists and experts who know a lot more about the specifics of the areas, but the graphs haven't come out too well. I was going to say a little bit about alcohol and the challenge alcohol is in our lives. We know from the data that our drinking prevalence across the population has not changed a jot. Problem drinking is increasing. Deaths related and associated with alcohol are increasing. And in the middle of all of that, there is huge inequality and huge inequity. We are currently in the middle of discussing and working with our new minister on the inequality agenda, which is one that he intends to focus very much on for the rest of his mandate. In the context of mental health, we know that in 2020, more than 1 in 4 people in some of our surveys were indicating a possible mental health challenge. We know from the hard data that our prescriptions for antidepressant drugs are increasing, and all of our other hard data and hard indicators are showing us that the position is not really improving. We also know that there is significant inequality and inequity in the middle of all of this. In the context, again, apologies, some of the graphs just haven't translated, but in the context of suicide and self-harm, again, when we look at the hard data, we're seeing some improvement, but not great improvement. Our suicide rates are high, and there is again significant inequality and inequity underneath all of that. While we're seeing in the hard data some reduction in what looks like a reduction in the admissions to hospitals for self-harm, you will see we are questioning whether that is a real reduction or that is a quirk of the way we're delivering our healthcare system and the way our healthcare is provided at the moment. And that may well be the true underlying factor. So when I usually would speak at an event like this, I would talk a lot about the data and the information. My world is a lot to do with information and evidence. But that's not what today is about. This is some of the hard data, some of the hard indicators, but we know that so much more lies beneath that. It is not necessarily just about the amount of people who come to hospital or the amount of people who get admitted to hospital. It's about much more than that. It's about the impact on lives, on relationships, and on healthy well-being. So, in 2020, our previous minister, Minister Swan, published our strategy called Preventing Harm and Empowering Recovery. And that is the strategic framework to tackle the harm from substance use, to run for 10 years. Now, the thing about this is, this was a New Decade, New Deal commitment. And the thing about this was, it was co-produced, and it was really strongly co-produced. And it is a much stronger strategic framework from that context, really importantly. There are 5 outcomes, and again, I don't intend to, others who are more expert in the field will talk more about the detail. But the outcomes, in broad terms, are about providing prevention and support services across the full life course, meaningful services, reducing harm, having access to high quality services, empowering people properly through their recovery journey, walking through those journey recoveries in partnership, and then the boring piece at the end, which is actually really important, which is the bit about having effective systems of governance, accountability and responsibility. And in my experience, as we work through a strategic framework like that, there are numbers of parts. There's the context, which you will know much more than I. There's the technical end, about the evidence, what works, what doesn't work. There is, though, as I've mentioned, the relational piece. What does this mean for individuals, communities, families? What does it mean from a relational perspective about how we do co-production in our health and social care systems? And there is also the personal aspect about what we all bring as individuals as we recognise we have to work together in order to recover together. So we need to be person-centred. We need to have shared responsibility. We need to evaluate and evidence that what we're doing makes a difference. And if it doesn't make a difference, it's an improvement, then we probably shouldn't be doing it. And we need to get brave at that. We need to have universal services, but be flexible enough to focus into areas that are really needed. And we need to have good, strong, community-based services informed and founded on the experience and expertise of people in this room. I'm going to say a very small bit about the relational and the personal bits in this. In my experience, as we work together, which in this context is recovering together, I've learned a number of important messages. It's about showing up, and it's about always showing up in the good times and the bad times, and sometimes just showing up. It's about paying attention to what's working, paying attention to what's not working, being brave if it's not working to say we shouldn't do it. It's about appreciating the other, because we all have a huge commitment to this and we all have a lot to bring to this, and we will only do it well if we do it together. Sometimes it's about doing the next thing. A piece of advice somebody gave me in the early days of the pandemic, when things were very overwhelming, was, Lourda, just do the next right thing. Sometimes you don't even know if it's the right thing. Sometimes it's about just doing the next thing and putting the next step in. It is about sweating the small stuff, from my perspective. A lot of people mightn't agree with that. They might say, take care of the big things and everything else falls into line. Where I work, the strategic framework is the overarching piece, and hopefully it enables everything else to fall in underneath. But on a personal level, I do think sometimes it's about sweating the small stuff. If you give attention to the small things, then everything else will also begin to align. It is about being intentional. It's about intentionally saying, this is about hope, this is about possibility, and this is about things that we can do and deliver really well here in this place. It's about making your difference. Your difference is not the same difference that the next person will make, but your difference is really important. And picking up on the message of our previous speaker, it is about looking after yourself. It took me a long time to learn that. It is really about looking after yourself, because if you don't look after yourself, you can't be the person that supports the person beside you or the person around you in your community that really needs help. But I think we need to do this with confident humility. This is a phrase, this is not my phrase, this is a phrase I've stolen from a colleague who worked in one of our other health departments in the course of the pandemic. We need to be confident. We need to understand that people in this room know what needs to be done, but we need to be humble about it, because we know our perspectives does not mean that we know all of everybody's perspectives. We need to be responsible and accountable. And we need to understand that even in the most difficult days, that this too will pass. And that has been my experience in good times and in the really challenging times. It does pass. And it is sometimes about just the next thing, taking the next breath and doing the next thing, and recognizing that you bring a huge amount to this. I'm not going to say very much about leadership overall, apart from two comments. One, For me and for the work we do in our Department of Health, everybody has a role in leadership, and that is really important. And in the context of the living leadership philosophy, it's about knowing yourself, making real connections, and getting help, and understanding that leadership happens between people, not because we tell people what to do. So I would say be the leader you can be, not the leader you think that people want you to be. Briefly in time, just to summarise just very briefly what I've learned that you need to know yourself, you need to be the leader you can be, and everyone brings something to the leadership. Be yourself in the role. You're more than enough for what is needed. It's a team sport. It's not an individual game, it's a team sport. Leadership happens between people, and trust is at the core of that, and we see that so much in some of the work that you do. It's not a binary world, it's not good or bad, it's a whole range of things across the middle. These are complicated, complex systems, and sometimes what looks like a judgment or a decision about we can't do something may well be the piece because of the complexity behind. They are very complicated systems that we need to work through, and it is about balancing. And it's about knowing and articulating value. And actually, I'm not sure about the word value there. I think it's about knowing and articulating benefit and help and improvement for people. And I usually summarise at the end, for me, with saying that the work I do in medicine is a privilege. And so much of what we hear these days are healthcare systems that don't work and things we can't do, and it's all too hard. Actually, there is a huge amount of hope, and working in this health and social care system is a real privilege for all of us. So I'm going to, I don't think we go backwards, I'm going to just summarise with two things. One is when our current minister visited ARC earlier this year, he was, and has spoken a number of times about how he was so struck by the hope that he felt when he walked into the room. And I like to reflect on this quote, which is that hope helps us to stand when sadness threatens to buckle us. Hope restores our energy when circumstances seem to defeat us. Hope glorifies the mundane. It gives us courage to dare to be ourselves and to reveal ourselves to others. To live in hope is to believe in light when it's dark, in beauty when the ugliness abounds, and in peace when conflict seems to reign. And we, certainly from our minister, are charged, and he says it every day to us, with putting hope back into healthcare. So action always starts with one small step. And you don't have to know precisely what the whole final journey is. You just need to start down the road. Because what counts is not the enormity of the task, but it's the size of the courage, of our individual courage and our courage together to walk down the tracks. So I wish you very well for the rest of the day. I look forward to staying and hearing from most people. And thank you very much. Looking forward to a coffee now.
Well, thank you very much.